Mm-hmm.
Recording. Okay, we're ready to go.
Hi, and hello there. This is Diane Kaiser with CalmUnity Global Internet Radio, and this morning we are going to be speaking with Vicki Karnes. Vicki is the co-chair of the Metro Atlanta chapter of the Georgia Diabetes Association. She is from Atlanta, and she is a registered nurse and a certified diabetes care and education specialist. Vicki, welcome to the program. We are doing Cheers to Your Health. This is our first actual episode that we are doing, and will be going globally. But this morning we're really interested and excited even to talk about diabetes. It is a huge, huge problem worldwide. So just from your perspective, what exactly is diabetes and how does it affect human beings?
Well, Diane, first, thank you so much for having me. It's a pleasure to be here and talk with you. I'd like to shine a light on diabetes. So let's lighten it, raise awareness about its importance around the world, how extensive it is. So one of the ways that a registered nurse or a diabetes care and education specialist helps a person living with diabetes is we're to help them better manage their blood glucose. Now, I say manage. First of all, manage versus control. And blood glucose is, in other words, blood sugar is the issue with diabetes. With the three main forms, but of the three main forms, the blood sugar in the body is too high. And we all have blood sugar. However, there are the three types. Let's say the person living with type 1, which could be a child or an adult, their body cannot process the blood sugar at all because they're lacking a hormone called insulin. So insulin is what helps the blood sugar get into the cell so it can provide fuel, energy. Type 1 diabetes, a person has very little or no insulin. That's not very common. What's most common is type 2 diabetes. And that is more affected that your body produces insulin, maybe doesn't use it. It doesn't use it well. So if we use an analogy or a word picture, imagine if you had a car and you went to the gas station and you pull out the nozzle, but you can't get the cap off the gas tank. So you've got fuel, just like sugar, think about it as diabetes, but you can't get it in the gas tank. So that's type 1 diabetes. See, type 2 diabetes, it doesn't work as well. Maybe you get the gas cap off just a little bit, but it's not working very well. So as a result, blood sugar, which normally is kept in balance, our bodies are so wonderful, all the systems they have to keep in balance, it is too high. The third type of diabetes can happen anytime during pregnancy for a woman, but typically about beginning of the third trimester of pregnancy, blood sugar is elevated. And the reason that's important is that if we don't keep our blood sugar within a target range, it can cause harm to the body, damage different organs. I'm trying to think of it in a way. Over time, there'll be complications. But rather than focus on the complications, as an educator, I have seen that people who are diagnosed with type 2 diabetes, and often it happens when you're older, as we get older, like a risk in your 60s is much higher than in your 30s. the person who's newly diagnosed with diabetes could be healthier than the average person on the street if they've learned to manage the diabetes with being healthy food choices. No sugary drinks. They're not smoking. They're using physical activity. They're aware of stress. And so what we like to emphasize is that you can live a long and healthy life with diabetes. If we have a little manage your diabetes ABCs. We can talk about the ABCs later, but basically there's 3 important measurements of diabetes. And I'm chatting with you now. Think about it to a toddler.
Yes.
Do you control the behavior of a toddler, or do you manage the behavior? You prevent them from injuring themselves, right? So you do things to keep them safe. So that's the idea behind managing diabetes, is you want a blood sugar that's as close to normal as possible, right? To stay safe.
Mm-hmm. Yeah.
And many people right now in the world don't feel safe because COVID-19 is making people sick and it's contagious. I will say now, diabetes is not contagious.
Good. That's
but
good.
But it is a lifelong condition. So it's not like you go to the hospital and you get cured. Mm-hmm.
The other thing that you said that was interesting to me, because I've been involved in public health for a few years, the 3 things that you mentioned, those risk factors of diabetes, they're the same risk factors. A lot of them are the same for heart disease, for lung disease, for cancer. I mean, if we were to actually address those risk factors and get them under control, like individually or personally, we would be really protecting ourselves from a lot of diseases, including diabetes, right?
Exactly. Risk factors. There are 2 types of risk factors. There's the kind you can modify, and there's the kind you can't.
Mm.
Correct? So a modified risk factor is lack of activity. Well, you decide you're going to walk an extra 10 minutes every day, small steps. A risk factor is extra weight. And the important thing about achieving a healthy weight is to don't set your goals too high, like maybe lose 15 pounds in a year, not 15 pounds in a month. Because you will be able to sustain that.
Yeah. We're going to take a little break, Vicki, and we'll be back with you in just a couple of minutes, and we're going to have a little station identification. Welcome back, and we are here with Vicki Karnes. This is CalmUnity Global Internet Radio. Cheers to your health. This is our first episode, and we are very pleased to have Vicki with us. Vicki is the co-chair of the Metro Atlanta chapter of the Georgia Diabetes Coalition. She's from Atlanta, and she is a registered nurse and certified diabetes care and education specialist. Vicki, thanks for rejoining us. We're glad you're here. And now we're going to talk a little bit about the ABCs of diabetes. And then I have an important question for you.
Oh, very good. Well, thank you, Diane. I'm very happy to be here. What most people don't necessarily have heard the word diabetes. They have a family member or relative or a friend who's been told they have diabetes. They don't really understand what diabetes is. So diabetes is a condition where the body has difficulty using the energy that's in our food. So most of the food we eat is digested and is used by the body as sugar. It's in your blood as blood sugar, and that is used by the cells, muscle cells, brain cells, fat cells, all sorts of cells in the body that all use blood sugar. So it's very common It's not inherited. You don't get diabetes from eating too much sugar. But there are three types. It's important to understand the difference. I will say right up front, type 2 diabetes is the most common. 90%, 9 out of 10 people with diabetes will have type 2 diabetes. And it is often associated with lifestyle. So our body digests food because there's a hormone called insulin that's used to help the blood sugar, the energy, get into the cell and be used for fuel. But with type 2 diabetes, there's not either your body doesn't make enough or the insulin you do make doesn't work as well. So as a result, the blood sugar level goes up. That's the most common kind, type 2 diabetes. Type 1 diabetes is less common, maybe one in 10 cases of diabetes are type 1. And a person with type 1, they don't make insulin at all. Either very little, don't make it at all. So the food that they eat, the energy that's in the food cannot get into the cell and be used. So an example might be if you had a car that you have an empty fuel tank, you want to go get gas, you go to the gas station, you take the nozzle and you pick it up and you put it in the fuel tank, but you can't get it in because there's a cap on the fuel tank. So the insulin is the hormone that takes the cap off and allows the fuel to go in. So a person with type 1 diabetes, from the time they're diagnosed, will need to take insulin for the rest of their life. So the third type of diabetes is it happens during pregnancy. It can happen anytime during pregnancy, but generally the third trimester or at 24 weeks of pregnancy. And that's a high blood sugar that is important. It's important for a woman to know that she has it because high blood sugar can harm the baby and the mother. It usually disappears after the baby's born. So those are the three types. Type 2, the most common. Body doesn't use the insulin well. Type 1, body doesn't make insulin. They have to take insulin for the rest of their life. And those don't have a cure.
Wow. Okay.
They need to be they're managed, in other words.
Mm-hmm. You mentioned something to me in a note, and you said that if a person actually addresses their diabetes, that they are as healthy or healthier than the average person walking on the street anywhere. Is that true?
Well, diabetes is a condition that is managed by the person. You may see the doctor every 3 months, but every day you can make healthy choices to keep your blood sugar in the normal range. We're talking about a target range. So by making healthy food choices, by avoiding sugar-sweetened beverages, by avoiding high-fat food, physical activity. Yes, they could be healthier. You could actually be healthier because you're making positive choices than the average person on the street. So a person with diabetes, it's important to know if they can live a long and healthy life. And a diabetes care and education specialist is like a coach to help them learn how to do that.
Oh, that's great. And there's a question I kind of really enjoy asking you, and that is, do animals get diabetes? And or is that only a human animal condition?
No. Actually, all mammals produce insulin, and diabetes is a disease of not enough insulin. So it's common. in cows, pigs, horses, cats and dogs, monkeys, for example. And I just would like to mention about the cow and the pigs,
Yeah.
because in 1922 was the very first time that a patient was treated with insulin, and it was a life-saving medication. And that was insulin that was taken from a pig or a cow insulin. So, but since then we've learned how to make humans insulin without using cows and pigs.
Yeah. Oh. Hey, are there any signals, physical signals, that you might be getting diabetes? Is there something that kind of, will tell you, uh-oh, time to have this checked?
I am so glad you asked, because there are signs that your blood sugar is high. And one of the most common is thirst. You're drinking, you're very thirsty. You drink a lot of water, or if you don't know you have diabetes, you might be drinking soda, which is making the problem worse. So because you're drinking a lot, high blood sugar causes you to urinate a lot. So you might be going every hour or waking up at night 3 times to go to the bathroom, right? So the other is fatigue. If you have a cut or wound that doesn't heal, that's because of the high blood glucose. For men, having an erection or having sex is an issue. High blood glucose affects the ability for men to have sex. It can affect your vision. And for some people, they might have a sudden weight loss. So those are so important that people know the signs. There is one other thing. A lot of these signs people might ignore. And they might think, oh, it's age, or, oh, I didn't get a good night's sleep. But what I like to emphasize is when a person starts feeling that the feet are numb, the high blood sugar has already affected the kidneys and the eyes. See, that's important to know. So when you're talking to people around the world, one of the things they say is, no, we don't have diabetes in my family, but my feet are numb and they hurt. And the pain can be so much it keeps people up at night. They can't sleep.
Wow. So is that neuropathy, diabetes? Is that
peripheral neuropathy?
Yeah. Okay. For people who are listening, if there are other questions, they want other information and just have needs in the area of diabetes, is there a place that they can be contacted, or contact either globally or nationally or locally?
Well, one of the best websites, the American Diabetes Association, it's centered here in the United States. Their website is www.diabetes.org. So if a person wants to learn anything about diabetes, how to manage it, how to prevent it, there's also the International Diabetes Federation. So if there's an association in your country, you're in Denmark, you want to know if there's a diabetes association in Denmark, you can go to the International Diabetes Federation website and check to see if they're a member, if they have a member organization.
Okay, great. And how about, is the World Health Organization, can they provide anything?
Well, the World Health Organization, quite busy now with COVID-19.
Yes. But
they have committed to a global diabetes compact to begin in April of 2021. There are so many countries that do not have quality medical care. They don't have medications. So according to the World Health Organization, 1 in 2 people with diabetes in the world don't know they have it.
Wow.
So there's going to be a global campaign to raise awareness about diabetes beginning this spring.
Okay. And just one more little question about the United States. Are we like the global leaders in diabetes? And as a leader, I'm thinking more of, do more Americans have diabetes than from other countries? Is our lifestyle, is the abundance of food and not always healthy choices, that can make quite a difference, like in global statistics, right? I mean, are we ahead of every other nation?
We are ahead of every other nation in how much we spend in treating diabetes.
Yeah.
China, maybe, I wish I had the number, China and India are number 1 and 2. The United States is number 3 with a number of cases. But we spend more money and don't necessarily have best outcome.
Yeah.
But that's what we're working for. That's why my organization and the Center for Disease Control and Prevention are working so hard to educate the population about their risk and importance of being screened for diabetes.
Hey, Vicki Karnes, thank you so much for being with us today. This is Vicki Karnes, RN, registered nurse, and certified diabetes care and education specialist, speaking to us from Atlanta, Georgia today, and we appreciate you being with us. We hope that this is not the last time that we do an interview with you, and we would like to suggest that you become, if possible, our diabetes resource for the world. Thanks again, Vicki Karnes.
Thanks, Diane.